Start.
Hi, my name is Letitia. I'll be your nurse today. Can you tell me your name?
My name is Eddie Mae Spike.
All right, Miss Eddie Mae. How old are you?
60.
All right. So today you're actually going to be getting a cardio and peripheral assessment. I'm going to be checking and touching around on your body parts for your heart, your veins, your pulses, different things like that, checking on your skin. It doesn't mean anything is wrong. It's just I'm doing a thorough assessment on you. Anytime, if you have any questions or concerns, please don't hesitate to ask or let me know, okay? All right, so just getting started. Can you put your arms straight out for me? All right, so I'm checking your arms, checking for symmetry. Your arms are both symmetrical, checking for hair distribution. Can you flip on the top side? Hair distribution is even. Can you squeeze my fingers? I'm checking your hand grips. Very good. All right, now I'm going to be checking your skin turgor on both hands. Very good. Your skin is bouncing right back, retracting. I'm going to be checking your pulses. These are your radial pulses. Good. Now I'm going to be checking for your brachial pulses. All right, very good. And now I'm going to be looking at your neck. I'm just checking your carotid arteries, checking for any lumps, bumps, or bruises, any pulsations. And I don't see anything on this side. I'm going to check on the other side. All right, I don't see anything on that side either. Looking very good. And now I'm going to feel on your neck. Can you take a deep breath, blow it out, and hold it? Now I'm going to listen. I'm going to feel. Listening with the bell of my stethoscope, the small side. All right. Okay, very good. Okay. All right, and I am going to go ahead and palpate those areas one at a time to make sure that we don't cut off your blood flow, your circulation. All right, pulses are strong, even. All right, and now I'm going to be inspecting your chest, checking for your heart. I'm going to be doing a little bit of education just to tell you about the different areas that I'm listening to. I'm going to listen with both sides of my stethoscope, the diaphragm, the large side, as well as the bell, the small side, okay? All right, so here I'm listening at the second intercostal space for your aortic valve. Right across from that, the second intercostal space, I'm checking for the pulmonic. Third intercostal space, I'm checking for the Erb's point. Fourth intercostal space, I'm checking for the tricuspid valve. And those are both at the left sternal border. And here for the midclavicular line. Fifth intercostal space, I'm checking for the mitral valve. Very good. Same here. Aortic, second intercostal. Pulmonic, second intercostal. Third intercostal, Erb's point. Fourth intercostal, tricuspid, both at the left sternal border. Fifth intercostal space is the mitral valve. All right, very good. And can you just lay back for me? All right, so now I'm going to be inspecting those areas on your chest and checking for any tenderness, any pain, any lumps, bumps, or bruises, okay? All right, so aortic, pulmonic, both at the second intercostal, Erb's point at the third intercostal, tricuspid at the fourth intercostal, and the mitral at the fifth intercostal. Can you roll over on your side? I'm going to check. This is your left lateral position. I'm checking at the mitral valve for your apical pulse. Okay, very good. You can remain laying flat on your back. Now I'm going to be checking for jugular vein distension. Can you look that way for me? Checking on your neck. All right, no distension noted there. Can you turn back this way for me? Same, jugular veins look good. All right, now I'm going to be checking on your lower extremities. I do have to palpate on those areas. I'm checking in your groin area for your femoral pulses. Very good. Strong pulses noted. Checking your behind your knees, your popliteal pulses. Those are very good. Can you scoot back a little bit for me? I'm going to check it on your feet and your ankles. Checking your posterior tibial pulses. Those are both strong. I'm going to take your sandals off really quick. I have to check the top of your feet. And these are both your dorsalis pedis pulses. Put your sandals back on. Those are strong and very good pulses. I'm also inspecting your legs, checking for symmetry and hair distribution. Both legs are symmetrical. Hair distribution is even. I'm going to be touching on you, palpating to feel for edema. There's swelling, no swelling noted in any of those areas. No varicose veins noted in those areas. I'm also going to be checking your heart for your pericardium. Just checking around your heart, looking to see if you have any swelling, no swelling noted in that area. Outside of that, I think that's everything. Yeah. Can you sit up for me, Miss Eve? Do you have any questions for me right now?
No, I do not.
Okay, thank you. Have a great day.
You too.
All right, so I am giving a report on a 60-year-old female. I did a cardiac and a peripheral assessment on her. I checked for her, I checked her upper extremities for symmetry, hair distribution, and I checked her pulses. Her arms were symmetrical, hair distribution was even. Radial and brachial pulses were strong pulses that were bounding. I checked her neck for her carotid arteries one at a time, so we don't cut off the blood circulation. And she had no lumps, bumps, or bruises noted in those areas on her neck. I listened to her heart, assessed her chest in all areas, the aortic, pulmonic, tricuspid, and mitral. And that was the aortic and pulmonic at the second intercostal space. Third intercostal space was the Erb's point. Fourth intercostal space was the tricuspid, both at the left sternal border. Fifth intercostal space was the mitral valve. I also had her in a left lying lateral position to check her apical pulse at the mitral valve. Pulses were strong, no tenderness. I checked for the pericardium around her heart. No tenderness noted in that area. I did her skin turgor on her hands. Turgor was bouncy, normal. Skin was warm, dry, and intact. Hand grips were even. I assessed her at the lower extremities. Legs were symmetrical. Hair distribution was even. Skin was warm, dry, and intact. I checked her pulses at the femoral arteries in the groin, the popliteal behind the knees. I checked her ankles at the posterior tibial. Those were normal, and as well as her dorsalis pedis. All the veins, all the pulses were strong, and the patient had no varicose veins noted, and no questions or concerns. Thank you. Have a good day.